Hey, and welcome to A Sip of Aesthetics, your new favorite podcast and YouTube channel and everything. I'm Dr.
Yeah.
Abraham, I'm your host.
And I'm Lauren Yeager, and I'll be his guest today. Second time around, I'm excited.
Second time.
Yeah,
Good to have you back. And
Thank
today
you.
we're talking about PRP, which I think is one of the most underutilized tools we have in aesthetics. I love PRP, Platelet-Rich Plasma. And if you're listening to this and you are interested in aesthetics and cosmetic medicine and all that stuff and anti-aging, you probably want to listen to this because I do believe most people can use PRP. It has just so many good benefits.
Nice, let's get into it. So, what is PRP?
So yes, PRP is platelet-rich plasma, and basically platelets are cells that are found in our body. So there's three kind of type of cells that run in our bloodstream. There's red blood cells, and red blood cells deliver oxygen. One of the main things they do. We have white blood cells, and one of their main functions is the immune system. And then you have platelets, and platelets are cells that are found in our bloodstream again. And one of the main things they do, these platelets are rich in growth factors and cytokines. They play a big role in repairing whenever there's an injury, and that's where a lot of their benefits comes from. So, for instance, if you were to cut yourself, the platelets are some of the first cells that would go there and start that healing process.
And then, where can you do PRP? Because I know I did PRP on my face and I loved it. So, where else can you do it? You mentioned injection, so I know joints.
Yes. So yeah, and kind of building off of that. So platelets are these cells, and with PRP, what we're doing is we start with using the patient's own blood, and we want to extract that platelet-rich plasma. That's what PRP stands for. We want to extract the plasma that's rich in these platelets, and then we use them, according to however we try to use them.
And you spin it, right? There's a machine, and you spin it.
Yes, so there is a process to start from the blood and then end up with that platelet-rich plasma. So obviously, when we take the blood, it's gonna look red, and sometimes the PRP is called liquid gold because it has that yellow gold color that you end up with after you're extracting it from the blood. So it can be used it has a lot of aesthetics used, as you've mentioned. So it can be used in cosmetic medicine. A lot of times people will use it with microneedling or with some other treatments or on its own. And the idea is that it's going to help rejuvenate the skin. So, as we get older, our skin starts to change. The skin can get thinner. We can start to see more fine lines and wrinkles. And so with PRP, what we're trying to do is we're trying to rebuild the skin layer. We're trying to rebuild the collagen underneath the skin. Which is why it's used in cosmetic medicine and in aesthetics, along other uses as well.
Like injuries too. So like somebody injures themselves, right? Shoulder,
Knees,
knee.
elbows.
Okay.
We do have a lot of athletes that come in because, and actually, it's one of the things that's becoming more popular. I mean, right now, a lot of times people will see that, like, right now, I know we're in the football season. But there's a lot of like football players or like soccer players that would go in an injury and then they try to like speed up the healing process. They might do a PRP in their knee and their Achilles tendon, whatever.
So it
areas
can be
needed.
injected everywhere. Like it doesn't have to be anywhere the injury is. Correct.
Yeah, most places. I mean, there's some areas where we like. There, for the most part, most joints, most musculoskeletal problems, PRP can be injected in most of these areas, but there's some limitations, of course.
Yeah.
And it also depends on the type of the injury. It's not like a replacement for surgery, but it can definitely help speed up the healing and a lot of these injuries.
I know that we can also use it for hair loss too, because I know a lot of people come into the spa with hair loss. So I know you can, rejuvenation, so you can inject it into the scalp, correct?
For sure, yeah. A lot of times people are losing their hair, they see their hair thinning, and we use PRP. Now, PRP isn't going to grow new hair, which is why you want to start early if you are experiencing hair loss or thinning hair, but it can make, the idea is to make whatever hair you have thicker, healthier, longer, and also to slow down the hair loss. The reason PRP has so many different applications is because kind of like we were talking, when it comes to your bloodstream, you have your oxygen or oxygen delivering cells, which are the red blood cells, which will kind of deliver oxygen everywhere. Your white blood cells will kind of help fight any kind of infection because they're not specific. And with PRP, because these platelets are these cells in your body, they're not like specific to one. They're not specific. The platelets, it's not like they only work in the lungs or they only work. They circulate through the whole bloodstream, and again, they're rich in the growth factors and these cytokines. So that's why they have a lot of different effect on our body, and they can be used in so many different places.
Now, when somebody comes in and they're nervous, for you to inject it, so you draw the blood and then you spin it and then you inject it. What's the downtime with that after you're done with the treatments? Like, say you do joint, say you do hair, does it differentiate between the service?
Yeah, for sure.
And the place? Okay.
For sure, yeah. It really depends on which treatment we're doing. It depends on which treatment we're doing and which area.
Okay.
Generally speaking, with a lot of these treatments, it's gonna take some time to see the full effects, because you're trying to fix the issue at the root. So whether you're doing it for hair rejuvenation or for a joint injury, it's not like when you're giving it exactly.
Okay.
So with PRP, we're going after the root cause, which is why it can take a little bit of time, to actually improve the joint, improve the hair. It's not just masking the symptom.
So now there are other options besides just doing the joint and the hair. We talked about joint, we talked about hair, we talked about face. There are other areas that we can inject PRP. Ladies,
for sure.
Listen up. If you're having trouble orgasming, right?
It can be used for sexual function.
Okay, there we go. So there's something called the love shot.
Yeah.
Right?
So PRP can also be used for sexual function for both females and males.
Female and male, yes.
Yeah. So it can help enhance that. So that is definitely one of the uses that are very
and that's
popular.
very popular too. Yes, we see a lot.
Yeah. It is an injection, but it's really not as painful as it sounds. It is, because when you numb the area and stuff, it makes it a lot less less painful. But people love it, and they come and do it over and over because they feel like it really works and it really helps them out. So it can be used for sexual function. It can be used for skin rejuvenation, as we mentioned, and not just face. It could be neck. It could be really anywhere in the body. Sometimes with wound healing, to help wound heal faster, or help with scar revision, especially when you combine it with laser and other treatments.
Okay, so Dr. Adam, we do call it here the upshot. So have you done it before?
No, I haven't, and that would be confidential, anyways. But I have not done it. The upshot is the kind of male version of the love shot. It's it would be also using PRP injections for sexual function, also very popular. And again, we start by using the patient's own blood. We grab the platelets, and then we numb the area, and then we inject it. And people do it to help them with the strength and duration of their erections, with the sensation, so for more pleasure. Yeah.
Can you do it? How many times a year can you do it, or should you do it?
It really honestly vary from person to person. I would say a lot of clients will do about once a year.
Okay.
But it can really vary from one person to another. But once a year, I think is pretty common.
That's great.
Yeah.
Come on in for your love shot and your upshot.
Yeah. Well, we have couples who come and do it together.
That's great. No, it's great to have that and have that option for people that need that. So
for sure.
And it's always, you don't want to talk about it because it's so
yeah.
Oh, I don't want to talk about that, but it's nice that we can offer something for somebody that has
For sure. And a lot of people, it's very common for people who don't have any problems. It's not like you have to have an issue, but they just want you don't have to have any problem. I would say most of our clients honestly don't have any problem, but they just want to take things to the next level.
Yeah, that's great.
Yeah. So that's honestly where most of the clients come in. Again, some people already have some problems and they want to try to fix them. A lot of people, they're like, I'm fine, but I heard I can, take things up a notch with that. It's like, why not?
Perfect. What is the process of PRP? I know you talked about you draw the blood, you spin it. So can you elaborate on that?
Sure, and actually that's probably one of the most important things when it comes to PRP, because a lot of times you do have patients who come in and like, I did PRP and I didn't see as many results. Some other patients see a lot of results, and there's a lot of factors, but I would say one of the most important thing is the quality, and a big part of that is the processing, the way the PRP is processed. So, and unfortunately, I see this all the time, all places where people will just kind of go, they give their blood, and then they're given a quote unquote PRP shot, but it's not, in a sense, it's not really PRP, even though it looks like it, because. And this is a bit technical, but it is really honestly very important. When we start with the blood and then we end up with the PRP, that process in the middle of extracting the PRP is going to vary a lot from place to place, depending on what kind of centrifuge they're using. And a lot of people do use a regular centrifuge that's just used for regular blood draws, and that's really not going to give you a good quality PRP. And the difference isn't just like, oh, this is a little bit better. The difference can be huge. It can be a really, really big difference. There's like single spin centrifuges and there's double spin centrifuges. There are centrifuges that are made specifically for PRP, and those tend to be a little bit more expensive, which is why there's also sometimes a difference in price, and people can get the cheap PRP somewhere, but it might not give them the kind of results that they want. So you want to make sure that you get the actual, good quality PRP.
Which we offer here.
We do offer here.
Great.
But you want to make sure you're doing your research, even if it's a little bit more expensive, because again, if you're getting, if the way that PRP is extracted, and just to kind of give you an example, there are a lot of machines that will give you 1.5 times concentration of the platelets. So what we're trying to do is extract the platelets. So if you start with whole blood and then you extract the platelets at a 1.5 times concentration, that's not a really high concentration of platelets. Versus if you do at 3 or 4 times concentration, that's gonna be, you're getting twice as many platelets or more. But if you do even like a 7 or 8 times concentration, again, you're getting a lot more platelets, and the concentration of platelets plays a huge role when it comes to the effects. So again, it's not like, you're gonna get 3 versus 3.5. You can be doing PRP with 1.5 times concentration and 7 or 8 times concentration. The difference can be huge. Again, I understand that's a little bit technical, but I do think it's very, very important to make sure that you do your research. You go to a place where they are, kind of like specialized in doing PRP.
If you're gonna do it right.
Exactly.
Yeah.
Exactly.
Perfect. Well, good. Well, that was amazing.
Yeah.
Thank you for going through everything. So we went through what PRP is, how you use PRP, where you can use PRP.
Yeah.
That was really fascinating.
And for sure, I think we can dive a lot deeper into like the different uses of PRP. But maybe we don't want to get the episode to be too long, so maybe we can wrap it up here. I'm sure we'll talk about PRP more in different episodes. But yeah, I hope that kind of gave everybody kind of like a good introduction about it.
If you guys have any questions, you can always drop us a DM. Like, comment, share. Obviously, this podcast, this is very near and dear to Dr. Adam's heart, as well as all of us. We appreciate you guys listening, and we'll see you soon.
Yeah, thank you guys for joining.